Hi, on today's episode of the Public Health Research Article Review Series, we are presented with a publication by Donko et al. 2024 on a systematic review on antimicrobial resistance in Ghana from the One Health perspective. Antimicrobial resistance, often called AMR, is now one of the top global health threats, and Ghana is no exception. The aim of this review was simply to describe the burden, patterns, and spread of antimicrobial resistance in Ghana across humans, animals, and the environment using the One Health approach. This approach recognizes that resistant bacteria in humans are connected to those in animals and the environment. AMR, or antimicrobial resistance, is rising fast. Globally, millions of deaths are linked to resistant infections. In Ghana alone, over 5,900 deaths were directly attributable to AMR in 2019. Misuse of antibiotics in humans and animals, easy over-the-counter access, poor sanitation, and weak regulation all contribute. Yet, surveillance data connecting humans, animals, and the environment is limited, making it hard to fully understand and control AMR spread. The study followed PRISMA guidelines to systematically review research published between 2014 and 2023. Researchers screened 1,789 publications and finally included 48 studies, which comprised of 28 human studies, 14 animal studies, 6 environmental studies. Data were extracted on the bacteria identified, the types of samples, which is urine, blood, meat, water, and antibiotic-resistant patterns, then levels of multi-drug resistance across sectors. The study revealed AMR is widespread across humans, animals, and the environment. A total of 48 different bacteria were reported, but the most common were E. coli, Klebsiella species, Pseudomonas species, and Salmonella species. There was also high resistance to commonly used antibiotics noticed in the study. Across sectors, resistance to the following exceeded 80% in many cases. For instance, ampicillin and tetracycline. Environmental samples like drinking water and hospital wastewater also contained highly resistant bacteria. Now, multi-drug resistance, which is MDR, is alarmingly common. MDR means that bacteria can resist 3 or more antibiotics. For example, E. coli. It has MDR levels between 41% and 100%. Klebsiella species also has an MDR level up to 88 to 100% in some studies. Staph aureus also has an MDR level up to 85%. Environmental Pseudomonas has 100% resistance to several antibiotics. Animal and food sources also pose significant risk. Resistant bacteria were found in poultry, cattle, fish, pigs, raw meat, which is sold in our markets. This means resistant infections can spread from farms to food and then to humans. Water and sanitation systems contribute to AMR spread. Hospital wastewater, drinking water, and streams contained E. coli, Staphylococcus aureus, and Pseudomonas species. Many showed multi-drug resistance, indicating environmental contamination is a major route of transmission. The review clearly shows that AMR in Ghana is a serious and growing problem. Resistant bacteria are not only found in hospitals, but also in animals, food, water bodies, wastewater, and public surfaces. The findings therefore highlight the urgent need for a coordinated One Health response involving human health, veterinary health, agriculture, water and sanitation, and environmental protection sectors. By way of recommendation, there's a need to strengthen One Health surveillance systems by integrating data from hospitals, farms, communities, and the environment. Also, there's the need to improve antibiotic stewardship by limiting unnecessary prescriptions and also restricting over-the-counter sales of antibiotics. It is only in Ghana that one can walk into any pharmacy or chemist and procure antibiotics without any prescription. This has to stop. Also, there's a need to enhance regulation in animal agriculture by reducing misuse of antibiotics in poultry and livestock. We also need to promote safe and responsible veterinary drug use. In addition, there's a need to improve sanitation and wastewater management by treating hospital and community wastewater before discharge, and as well improve potable water systems. Public awareness and education is also very key in this fight against AMR. We need to encourage hand hygiene, infection prevention, and responsible use of antibiotics. So there you have it for today. And as always, you can call me the Public Health Guy.